Reciprocal IVF can be a meaningful option for some LGBTQ+ couples. In a typical reciprocal IVF path, one partner may provide eggs, embryos are created with donor sperm, and the other partner may carry the pregnancy. But every family is different, and the cost questions can be more layered than people expect. Here are the cost questions to ask early. First, what is included in the quoted reciprocal IVF price? Ask whether the quote includes monitoring, egg retrieval and anesthesia, embryo culture, genetic testing, embryo transfer, medications for both partners, donor sperm, embryo freezing and storage. Clinic quotes can vary widely, and some costs may not be listed in the headline price. Second, are both partners treated as patients? In reciprocal IVF, one partner may go through stimulation and retrieval, while the other partner may go through uterine evaluation, medication, and embryo transfer. Ask whether each partner has separate consults, labs, monitoring fees, medications, or insurance billing. Third, what donor sperm costs should we expect? Ask about donor sperm vials, shipping, storage, genetic carrier screening, donor profile access, and how many vials the clinic recommends. Also ask whether your clinic has rules about known donors versus sperm banks. Fourth, does insurance cover any part of reciprocal IVF? Coverage may depend on your plan, your state, your employer, medical diagnosis rules, and how the treatment is coded. Ask whether IVF, IUI, medications, diagnostic testing, prior authorization, and out-of-network coverage apply to your specific plan.
Fifth, are there legal steps or counseling requirements? Donor conception and LGBTQ+ family building may involve legal, consent, or counseling requirements depending on the clinic, state, and family structure. Ask your clinic what is required before sperm purchase, embryo creation, embryo transfer, or birth. Sixth, what happens to unused embryos? Ask about storage fees, renewal fees, transfer policies, donation options, discard policies, and consent forms. These questions are easier to answer before treatment begins than after. Seventh, what is Plan B? Ask what happens if the first retrieval does not produce embryos, if the first transfer does not work, if donor sperm needs to change, or if one partner's treatment plan changes. A realistic Plan B helps avoid emotional and financial surprises. Reciprocal IVF is not just a medical process, it is also a financial, legal, emotional, and logistical process. Before you begin, ask for a line-item quote, insurance review, donor sperm plan, storage policy, legal checklist, and a realistic second-step budget. Educational only. This is not medical, legal, financial, or mental health advice. Talk with qualified professionals